welcome to the Health Show. I'm Dr. Anita Raja, and we are here live on Sky 752. You can watch us on Facebook, on YouTube, on Twitter, wherever you are. Stay with us. If you want to ask us any questions, it's very simple. You've got the number on your screens, 01924 231 083. Our WhatsApp number is 079 50797 017. And on Twitter, you can contact us on British Muslim TV. The conversation we will have today is around cervical cancer. It's something that is sadly ignored quite a lot in the BAME community. So we thought it might be appropriate for us to invite someone who is absolutely lovely and spreading a lot of awareness in the BAME community, actively involved when it comes to health inequalities within the healthcare system, and also spreading awareness within people from the Asian ethnic minority groups. Dr. Bushera Choudry, who is Vice Chair ASDOC, Chair Doctors Worldwide, and I've had the pleasure to work with her. Welcome to our show, Dr. Bushera.
Assalamu alaikum. Thank you so much for having me and for that lovely introduction. It's a pleasure to be here.
Dr. Bushera, I was just thinking the other day that when it comes to cervical cancer, cervical screening, unfortunately, there's not much we know about it when it comes to awareness within the BAME community. Now, my first question is, could you tell our viewers what the cervix is?
Sure. The cervix is part of the female anatomy, where it is at the neck of the womb. So it's found at the top of the vagina, and it's not accessible to you and I. We have to use an instrument to be able to visualize it.
Excellent. I think that was one of the best explanations we've had so far of where the cervix is. Now, as you know, Dr. Bushera, not many women are keen on cervical screening when it comes to attending these appointments. There's a lot of hesitation, especially in women from the BAME community, and they'd rather not go in because they're worried about the fear of the unknown. They're worried it's going to be uncomfortable. They're worried that it's unnecessary. They've got just one partner. Why do they need to go in? What do you have to say to this?
Sure, there's some really important points to think about there. And if you have had any type of sexual contact, you should have a cervical smear. And this is a test not for cancer, but it's to test for pre-cancerous changes. So it's to detect changes early to stop you getting cancer. So although it might be uncomfortable, it's very short-lived, and you could have the test once every 3 years from the age 25 to 60, 50, and then after that, every 5 yearly. And during that time period, it's a very short amount of time that we really should make an effort to take time out of our busy schedules to prioritise this, as missing your smears can be really detrimental to your health, causing you to develop cancer, which could have easily been detected with a cervical smear test. It can be embarrassing. Yes, people feel that they don't want to show that area to another person. However, there's very little that we haven't seen before, and we're there to do a job and we get it done. It doesn't matter whether you have hair there or no hair, what your private areas look like. We are there to do a job, do it quickly and as painlessly as possible. If you've had a bad experience, it's important to let the nurse or the doctor know that the last time you had a smear, it was painful, or you might have had other reasons to be hesitant to have your smear test. You might not want to disclose those because it could be very personal to you. But if you give the healthcare professional who's taking the smear a hint that you might have some personal reasons to why you're hesitant about having the smear test, they'll be able to take that into consideration and talk you through the process to try and relieve your anxieties.
Dr. Bushera, thank you so much for explaining it so well. Now, another thing that I wanted to sort of ask you in terms of cervical screening is, yes, so we get the appointment, we go in, we get the smear. After that, what actually happens?
Sure. So when the smear test is taken, a small soft plastic brush is used to just gently swept across the cervix, and that collects some cells. And also, if there is a virus present, the human papilloma virus, the initial test is to look for that virus. And this virus is known to be associated with cervical cancer. So if you have the virus present, at that point they will then look at the cells taken in the sample to check if there are any precancerous changes.
Lovely. Dr. Bushera, we've got two questions that have come in. So I was going to ask you these questions. The first question is, does it hurt to have a smear test?
It can be uncomfortable. Okay, so when I personally had it, it's uncomfortable, but it's tolerable. Some women have it and they don't feel anything. It just depends on individual to individual, but it shouldn't be very painful. If you have had a very extremely painful smear test, let the healthcare professional know the last time you had it, you had a bad experience, it was very painful. It may be that you have something else going on that is causing the pain, and you should talk to the healthcare professional about that. Often we find women have something called vaginismus, which is basically the muscles in the vagina contract, and it makes them very, very tense. And then when the smear test is being done, it's very difficult for you to relax those muscles, and that can cause pain. And there may be other factors causing the pain. So it's important to talk about the experiences you have to make it better the next time. And we use different sizes of instrument for different examinations. So if you needed to have an examination with a smaller speculum, it's important to remember that and maybe let the nurse or the doctor know that, the last time you had to use a small one, so they would use that one straight away.
Lovely. Another question that has come through is, how old do we need to be before we can start having our smears?
Sure. So in England, the age is 25. And the reason it's 25 is because pre-25, a lot of changes occur in the cervix, and in the past it led to unnecessary treatments to the cervix, that those changes would have, if left alone, would have maybe eventually gone away or got better, and it led to lots of unnecessary procedures being done on young women, namely having treatments to the cervix, which then later on led to them having miscarriages and not being able to carry pregnancies to term.
Dr. Bushera, another question I wanted to ask was, in terms of the signs and symptoms, what do we need to look out for?
Sure. So it's important to state that the smear tests are for women with no signs of cervical cancer. It is not a test for cancer. If you have symptoms which we are worrying, those include bleeding after sex, bleeding in between your periods. So you've had your periods and maybe like 4 or 5 days later of no bleeding, you then have some more bleeding. An abnormal discharge or bleeding after the menopause, meaning if you've had no period for 1 year and then you suddenly get a period, that's a change, that's bleeding after the menopause. These are all symptoms that you should be making an appointment to see your GP.
Thank you, Dr. Bushera. That was such a lovely way of explaining the whole signs and symptoms that we have to sort of look out for. And as you know, viewers, at the moment, we are here discussing cervical cancer. We've discussed what age we need to be at when we are invited. And of course, it's NHS England, the NHS screening program, that sends us out these invites. And it's very important for us to actually attend these appointments and not miss them, because as Dr. Bushera rightly said, it is a screening program. So it is a way of identifying precancerous cells, which can actually prevent us from having cancer, and it can actually help us save our lives. So it's very important that we sort of encourage one another to actually attend these appointments when we get them. We've got our telephone number on the screen, 019-24231-083. Our WhatsApp number is 079-5079-7017. Our Twitter is British Muslim TV. If you have any questions that you want to ask us, please do not hesitate. WhatsApp us, call us, because we're here to answer all your questions. And the whole aim of this show is that we are here together answering your questions. So it's time for a break. And we'll be taking a break in the next couple of seconds, I've been told. So the most important thing here, viewers, is that we keep in mind that if you've got any symptoms, for instance, if you've got postcoital bleeding, we call it that, which is having bleeding after having intercourse, if we have bleeding between periods or after menopause, it's important that Show. I'm Dr. Anita Raja, and we're here to discuss cervical screening, cervical cancer today. If you want to be part of our conversation, just give us a ring, 01924231083. Our WhatsApp number is 07950797017. We're here live on Sky 752. You can catch us on Twitter, you can catch us on Facebook and YouTube, wherever you are, stay tuned. We've got lovely Dr. Bushera here with us from Salford, GP in Salford, who's actively involved in health awareness. And we were having this lovely conversation around what we need to look out for, cervical screening, cervical cancers. So Dr. Bushera, another question I sort of wanted to ask you was that some people think that when they have the vaccination, the HPV vaccination, they don't need to go for cervical screening anymore.
That's a really good question to consider. Although the vaccine programme for HPV has been a great success in reducing the cervical cancers, it's not 100% effective like all vaccines. Currently, the HPV vaccine that we have is approximately 70% effective. There is a new vaccine being developed, but it's not yet out yet, which is going to be about 90% effective. But currently we don't have a 100% effective measure, and so it's really important that even if you've only had one partner, that you should still have a cervical smear. HPV is not associated with promiscuity or having multiple partners. You can get the HPV virus even if you've only ever had one sexual partner.
Okay, Dr. Bushera, in terms of risk factors, you've said that, you know, having sexual contact is a risk, of course. What other risk factors are there?
With cervical cancer, I mean, it's the fourth most common cancer in the world, and sometimes it can be unpredictable. If you've had a family history of cervical cancer, you may be more aware of the symptoms and, you know, keeping up with your smear tests. But ultimately, it's a change in your bleeding pattern that is the main thing that you need to look at. If you are bleeding in between your periods, or after sex, or after the menopause, or an abnormal discharge, that something's changed, it's really important to seek medical attention and do it early.
Right, and you know, they also say that smoking is a risk factor for it. Is that right?
That's right, absolutely. Apologies, I should have mentioned that. So if you are struggling to give up smoking, there are smoking cessation services available, and we know that those people who use smoking cessation services are more likely to quit and remain cigarette-free for longer than those people who just try and stop alone. So I really would encourage you to seek smoking cessation clinics, which are readily available around the country, and you can contact your GP surgeries to ask where the local clinic is if they don't have one in their actual surgery.
You mentioned some signs and symptoms that we need to sort of look out for, and of course we need to speak to our GP, but how quickly are the referrals done if you've got any red flags?
Sure, if you have those symptoms, it's really important to have an examination. So your doctor would want to have an examination of your cervix and also maybe take some swabs to check out for infection as well, because those symptoms are not only the symptoms of cancer, there could be other things going on. So it's really important to have an examination to rule out infection and other causes. Sometimes polyps in the which is an outgrowth of the normal tissue, can cause irregular bleeding, and that's not a cancer. So the chances of cancer is low, but if we did suspect that after the examination, you would have an urgent 2-week wait cancer referral. That means from the day of your referral from your GP practice, you would be seen within 2 weeks by the gynecologist in the specialist cancer clinic, where and that would happen within 2 weeks.
Right. And Dr. Bushra, when they are seen by a gynecologist in the 2-week wait clinic, what happens there?
Sure. So you have a specialist test, something called colposcopy, usually. So when they would have a look at the cervix, but use a microscope, and then certain things would be added to the cervix to highlight if there's any abnormal cells, and if there are abnormal cells, a biopsy may be taken, and then they would look at those cells under the microscope to identify if there is cancer.
Thank you for explaining this so well. Dr. Bushra, another thing I wanted to ask you was that some people don't want to go and see their GP or don't get a smear because they're worried that it's going to be a male doctor or a male clinician. They're not comfortable. What sort of message do you have for them?
Sure. Well, the majority of practice nurses do the smear test, so they do the majority of the smears. In my practice, the nurses do the lion's share, and I do the ones that are difficult. So the ones that the nurses have not been able to achieve, I will see those patients. So usually you are able to find someone who is female if that's what you feel more comfortable with, and if you can't get an appointment at your GP surgery for some reason, or it's not convenient for your timings, there are other places you can go to. You can go to the sexual health clinics, you can go to the family planning clinics also, and those places will readily do smears as well. The best thing to do is once you get your letter, you take that letter with you when you have your appointment, and on there it will have the dates of your last smear, your NHS number. So it's really easy for whichever clinic that's picking up that smear test to get the relevant information. But it's okay if you don't have that letter, and they can still get all those details with just getting your name and date of birth.
Lovely. Another thing I wanted to sort of ask you was that if people are worried about it being painful, is there any benefit of taking any sort of ibuprofens or paracetamols before the procedure?
You can do, yes. If it has been uncomfortable in the past, I would say half an hour before your appointment, take 2 paracetamol or ibuprofen if you have taken ibuprofen before and you can take that medication. And that might help you. But usually it shouldn't be extremely painful that you have any ongoing pain afterwards. It's very short-lived discomfort. And once the smear is taken, you shouldn't be left with any ongoing problems.
Another misconception as well is that women who've had part of their womb removed, a partial hysterectomy we call it, feel that they may not require a cervical smear anymore. What do you sort of have to say to that?
Yeah, anyone who has a cervix should have the cells looked at. So if you've had a partial hysterectomy, only the womb has been removed and the cervix is still there. And that's quite a common procedure. So if you have had your womb removed, i.e. a hysterectomy, it's important to know if it's a total hysterectomy, you don't need to have smears because the cervix has been removed. But if it's partial, it's really important that you have your cervix examined as the 3-yearly protocol.
Lovely. And Dr. Bushera, if we think about sort of cervical cancer and awareness around it, what do you sort of have to say about the awareness in the BAME community, because you work very closely with them?
Sure, I think there is an issue with people not attending for their screening appointments because they feel that it doesn't apply to them because they've only ever had one sexual partner. And it's that misunderstanding that even if you've only ever had one sexual partner, you still can get the HPV virus, and it's nothing to do with promiscuity, or there's no sign of your partner being unfaithful. It's nothing like that. This virus, anyone can get it, and most people get this virus at some point and the body will clear it. It's those women that have the virus and they're not able to clear it that can go on to develop cervical cancer. So that's really important that it does apply to you. If you have a cervix and you have had sexual contact with even just one person, then you should be having the regular smear test. And also there is a level of embarrassment. People don't like to openly discuss smear test because they don't want to discuss their cervix. It's a private part, and they won't prioritise it because they're embarrassed of telling someone, oh, I need to go and have a smear appointment, I need to make an appointment. So it's really important for everybody to just be able to understand what it is. And if you don't want to call it a smear test, I mean, there's nothing wrong with that. You could just say it's a precancerous screening test, which is exactly what it is. So we really need to take that taboo away from it and push the message, you know, this is to stop people getting cancer. And I'm sure if you ask everybody, do you want a test that stops cancer, the majority of women will say yes, but it's the other barriers that we need to look at about making the appointments.
Dr. Bushera, we've got only 3 minutes left, but we'll try to squeeze in 2 quick questions. One of them is that a viewer is asking us if they've had an STI in the past, could that lead to cervical cancer?
There's no link with the STIs and cervical cancer. We know that it's associated with the HPV virus, which is transmitted through sexual contact. However, it's not a marker of having multiple sexual partners or being unfaithful. This is a virus that anyone can contract.
Lovely. Another question is that there's this lady who's asking, she's got irregular periods once or twice a year. Could that lead to cancer? Could that be a sign of having cervical cancer?
If you have so few periods, it's important to speak to your doctor because that could be a sign that you could develop problems with actually the lining of the womb rather than the cervix. So it's in the same female anatomy, however, it's not quite the cervix. So that's important as well. If your periods are so infrequent, to discuss it with your doctor and to have a look at, you know, the number of periods you're having in a year, because it could be a sign of something else going on.
Yeah, Dr. Bushera, also, you know, you did mention intermenstrual bleeding between periods. How many cycles do we need to keep an eye on before we're actually investigated?
Yeah, I think if it happens once, then you're having keep a diary, and then the next month, if it happens again, that's okay. But even if it happened the first time, you know yourself, if you haven't had that happen before and then all of a sudden something has changed, it's important to be aware of that. And you can make an appointment with your GP and talk it through, and they may say, let's watch and see what happens, or they might say, oh, actually you're due your smear test, why don't we bring you in and have a look at your cervix, take some swabs and examine you. So I think it's like, if you have noticed a sudden change and something is different, then you should seek medical attention rather than waiting for a long period of time.
Dr. Bushera, thank you so much for being part of our show, taking out time to talk to us about this very, very important topic. And I hope that you have a lovely rest of your day.
Thank you so much. It's been a pleasure.
Viewers, thank you very much for joining us today on The Health Show. I'm Dr. Anita Raja. If you have any more questions that you still want to send us through, please contact us on Facebook. Our telephone number is 01924231083. Our WhatsApp is 07950797017. I hope you have a lovely day and join us next week, because that's what we want. We want to answer your health queries and we want you on our show. Have a lovely, lovely day. Thank you. Khuda Hafiz.